Good afternoon. Welcome. I am Dr. Jill Brooks, Director of Education for First Healthcare Compliance. First Healthcare Compliance is helping healthcare providers and billing services around the country reduce compliance risks by using our cloud-based comprehensive compliance solution. Each month, we provide a free monthly webinar bringing different experts in the field to discuss topics relative to healthcare practices. We are so pleased to have Mike Nolen, Vice President of Nolen Associates, discussing emerging risks in healthcare practices and how to protect your practice. Nolen Associates is a full-service malpractice insurance agency representing over 1,000 healthcare professionals and facilities in Pennsylvania, Delaware, and New Jersey. Providers face additional risks today that did not exist prior to HIPAA and high-tech. As you see in the headlines, there is a focus on patient privacy exposures and any security breaches. I think Mike will help us understand what we need to do to protect ourselves. Let's get started with his presentation. Are you worried a HIPAA or cyber exposure could ruin your practice? Your medical liability carrier can help.
Thank you, Jill. I'm happy to be here today to share what I have learned regarding HIPAA and cyber exposures and how your medical liability carrier should be able to help mitigate these risks. I'd like to give you a little background on myself and Nolen Associates. I've been working in the insurance industry for 22 years. For the past 20, I have specialized exclusively in medical liability insurance. Nolen Associates was formed 30 years ago to help medical practices secure quality liability insurance at competitive rates. Our current focus states are Pennsylvania, Delaware, and New Jersey. While we are a regional agency, the information I present today applies nationwide. For better or worse, traditional medical liability insurance has been around for over 110 years. Newer threats to medical practices include HIPAA and cyber exposures. Medical liability carriers have taken steps to address these risks. The objectives of this webinar are to identify the additional risks medical practices are exposed to, such as HIPAA proceedings, cyber claims, and billing audits. Also provisions of the Emergency Medical Treatment and Labor Act, or EMTALA, and Stark proceedings. I will provide real-life examples of these exposures, as well as a recent matter experienced by one of our clients. We will then review how the medical liability industry is responding to these risks and provide examples of the coverage many carriers already provide. Lastly, I will provide estimates for purchasing additional coverage for a practice that feels the need to increase their limits of liability. If you are a current client or potential client of First Healthcare Compliance, you already understand the threat of a HIPAA action. The number of HIPAA complaints has nearly doubled over the last 8 years. There have been thousands of investigations and to date, fines totaling over $25 million. Cyber claims are a threat to all businesses and are in the news continually. While Sony and Target generate the largest headlines, the healthcare industry is most impacted. 44% of all data breaches come from healthcare. Why the healthcare industry? One reason is a patient record is significantly more valuable to hackers than a credit card number. Medicare RAC audits have resulted in over $8 billion returned. While the majority of these audits have targeted hospitals and healthcare systems, physician practices have also been affected. Keep in mind, many audit findings have been lowered or overturned on appeal. The appeal process can be expensive, but you may be able to insure against this risk. EMTALA, the act that prohibits patient dumping, and the Stark law, which limits certain physician referrals, are not necessarily emerging risks, but it should be known there may be insurance protection for these potential issues. There have been many headlines across the country regarding these exposures. Here are a few that have caught my attention. Healthcare worker pleads guilty to stealing patient identities. This involved a hospital employee stealing identifying information and selling it to individuals who then filed fraudulent income tax returns. Dermatology practice settles potential HIPAA violations. An unencrypted thumb drive containing over 2,000 patient records was stolen from a car of one of the practice's employees. This resulted in a $150,000 payment. $100,000 HIPAA fine designed to send message to small physician practices. This was the first small practice to pay a resolution amount in 2012. The matter involved posting surgery and appointment schedules on an internet-based calendar that was publicly accessible. Plaintiff lawyers eye data breach niche. Law firms see big potential for money against the healthcare industry in the form of class action lawsuits. A few more headlines worth touching on. Health system agrees to settle over alleged rules violation. This is an example of a stark investigation. It should be noted the health system voluntarily disclosed this misconduct. U.S. settles accusation that doctors overtreated. The physician group settled the accusation for over $500,000 without an admission of guilt. The article does not say what their legal expenses were. I'm assuming they were substantial. These expenses may have been paid for or partially offset by their medical liability carrier. Community Health says data stolen in cyber attack from China. This was one of the largest stories in our industry last year. Patient notification and credit monitoring alone could cost over $15 million. Are you at risk? If you maintain personally identifiable information, you are. If you have Medicare patients, you are. More than 90% of healthcare organizations have experienced at least one data breach over the last 2 years, according to the 4th annual Ponemon Institute benchmark study on patient privacy and data security. Data breach isn't only from hackers. It also generates from your own employees. This is an example, a real-life example, of something that happened to a client of ours. An employee of a medical practice looked up the electronic medical record of a patient seen in the hospital. The patient was an acquaintance of the employee, not a patient of the practice. Ultimately, the patient discovered their record had been viewed and retained an attorney. The practice received a written demand for damages shortly thereafter. Thankfully, this client had a level of cyber coverage that helped ease the cost to the practice. Keep in mind, this happened to a well-managed and highly regarded practice. It can happen to anyone. Misconduct isn't the only employee risk. Unintentional breaches are also possible with the increased usage of cell phones, tablets, personal computers, and social media. How do you mitigate your exposure? Obviously, if you have a compliance program in place with First Healthcare Compliance, you have already taken a major step. There are additional safeguards that should be in place. However, I'd like to spend the rest of our time reviewing the additional insurance available through your medical liability carrier. Of the top 10 writers in the country, most provide limited coverage to address these exposures without additional charge. You may also have the ability to increase this basic coverage at a reasonable rate. If your carrier does not provide this additional coverage, it may be a good time to find one who does. These are samples of the basic additional coverage provided by 2 of the leading national carriers. This coverage is provided without additional charge. We will start with Carrier A. This is a well-established and often copied schedule of coverage. The carrier provides legal defense coverage up to $25,000 for a disciplinary, licensing, or administrative proceeding. This is the first I have mentioned this type of coverage today, but it is worth noting its availability. For Medicare or Medicaid billing actions, the company will pay up to $25,000 defending an investigation. Keep in mind the basic coverage with this carrier would not cover any fines or penalties, and the carrier reserves the right to select their own defense counsel. The cyber coverage is $50,000 and covers loss and defense costs for a network security wrongful act or privacy wrongful act. It also covers regulatory fines and penalties, including HIPAA. The cost of patient notification and credit monitoring is covered up to the limit of liability. The carrier also covers the cost to recover or replace data that is compromised, damaged, lost, erased, or corrupted, again up to the limit of liability. Over to Carrier B. Carrier B's coverage is a newer plan that provides greater limits of liability and could be more comprehensive. The administrative defense coverage is $50,000 and covers disciplinary and licensing proceedings. It also covers EMTALA and Stark Law investigations. It covers civil actions brought against the practice by an employee, also known as Employment Practices Liability, or EPL. It covers billing audit expenses, including shadow audits. The billing coverage includes governmental or commercial payer. This product covers fines and penalties. The insured has the right to select their own attorney. The information network security, or cyber coverage, includes media liability insurance, regulatory privacy proceeding, patient notification, and credit monitoring. It also covers data recovery, business interruption, and cyber extortion and terrorism. This layer of coverage is $100,000. Is the basic coverage enough to properly insure against a HIPAA or cyber claim? It depends on the practice. You'd have to evaluate your own risk to determine what limits would satisfy your comfort level. We have had both large and small practices raise their limits. We have also had many practices who are comfortable with the basic coverage. You most likely have the ability to raise these basic limits up to $1 million. The cost to raise the limits is usually based on the number of full-time physicians. $1 million of cyber coverage for 40 physicians is going to cost more than $1 million for 4 physicians. Using Carrier A from the previous slide as an example, a group of 4 physicians could raise their cyber coverage from $50,000 to $1 million for less than $1,000. They could also purchase a comprehensive billing audit product of $1 million for less than $4,000. In other words, for $5,000 annually, a practice of 4 could have $1 million of cyber coverage and $1 million of billing audit coverage. The billing audit coverage does provide shadow audits and also covers the cost of appeals. I suggest you contact your broker or carrier to determine the additional coverage in your policy. Again, if additional coverage isn't available, you should explore your options. The medical liability marketplace is as soft as it has been in years. I do not know of a carrier that is not looking to write new business. Consider increasing the limits of liability. Most likely, it is less expensive than you think. This third point is an important one. If you already have a cyber policy separate from your medical liability carrier, review it with your medical liability broker. The cyber coverage available through your medical liability carrier may be less expensive, more comprehensive, and more suitable to the healthcare industry. I have seen policies that are designed for all businesses. Those policies, in fact, exclude some of the coverage that would be most important to a healthcare practice. Going forward, if you are notified of a potential claim, incident, or investigation, contact your medical liability broker first. I hope I made it clear during this presentation. They offer much more than traditional medical liability insurance. I want to thank Dr. Jill Brooks and the entire First Healthcare Compliance team for letting me present this information today. Please do not hesitate to contact me with any questions.
Thank you, Mike. If you have any questions for Mike, please use the contact information on the screen. Our team at First Healthcare Compliance is available to you 9 a.m. to 8 p.m. Eastern Standard Time. Please call or email us if you have questions or would like to schedule a demo of our software.